Hello, dear friends. I am with you, Sofya Dorinskaya. I am a psychiatrist and the head of the Medical Information Center. After yesterday's video about restoring thyroid function, I received a lot of comments, but I decided to voice one comment today and respond to it, because apparently it was written by a doctor. Marina, elevated thyroid stimulating hormone, is a sign of hypothyroidism, not the restoration of thyroid function, and requires an increased dose of Euthyrox. Doctor, please be more attentive, blah 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 and blah blah blah. Well then, doctor, let's figure out what my previous video was actually about. And to make it clear for everyone, let's set aside the thyroid gland for a moment. And let's look at how a car with an internal combustion engine starts up and begins to work. I'll draw it for you now. So here we have a car with an internal combustion engine. Here is the piston which moves along this crankshaft. Here are all these little pistons and so on. This is already running. An internal combustion engine running on gasoline. But this internal combustion engine which runs on gasoline doesn't just start on its own. There is an intermediate step. An electric motor, a small electric motor, which needs to be started by the battery, positive and negative. Why does a car need a battery? To start it. This small electric motor, through a system of gears, must provide enough force. If the force is insufficient, it won't be able to turn the gasoline engine over with enough power to start it. There's a whole system of these gears so that the crankshaft starts turning, and that's it. Our main gasoline engine starts running. We have an essential intermediate procedure to get the primary propulsion engine running successfully. That's this small electric motor. Furthermore, when the vehicle is completely at rest and the engine is off, absolutely no electrical current from the battery is flowing to any part of the system. When the gasoline engine is running, there is no current flowing from the battery. The current from the battery acts like an impulse, like a driving force, like a push. It only flows at the moment when it's necessary to start the small electric motor, so that it moves this gear system and gets the internal combustion engine running. Let's go back to the human body. We have a thyroid gland. I'll draw it like this. The thyroid gland does not work on its own. In the anterior lobe of the pituitary gland, we have that very thyroid stimulating hormone. The pituitary gland is responsible for regulation, just like here, where the small electric motor starts the large gasoline engine. In the same way, in our body, the pituitary gland regulates the function of the thyroid gland. Now let's recall what I was talking about in this video. In April, a 41-year-old woman comes to us who has hypothyroidism. In other words, her thyroid gland isn't working, and she is given additional hormone. We start giving her nutrients. She joins a program for addressing nutrient deficiencies. Naturally, iodine is included in the regimen as well. And on July 15th, we see the first signs in her. These are signs of hyperthyroidism. Doctor, you missed it. That on July 15th, she already had signs of hyperthyroidism. According to her tests, there is recovery. Her own hormone levels are being restored, and according to the tests, she has an elevated level of thyroid stimulating hormone, a pituitary hormone. What are you looking at right now? You are looking at the system that triggers the thyroid gland, doctor. You need to be able to assess the indicators because you are looking at life itself, at the course of life. Do you understand? You don't just come in and grab at some random moment a blank that's been made and machined at a factory, maybe even machined incorrectly, and now you sit there with a file trying to finish it. No. You are interacting with a complex living organism. What exactly would happen if the crucial thyroid gland doesn't work well, if it doesn't secrete hormones properly? The anterior lobe of the pituitary gland starts to push. It begins to actively secrete thyroid-stimulating hormone. Tropic means related, native, right? It says work. When a person comes to you and you see that their thyroid-stimulating hormone is elevated, while their own thyroid hormone levels are either normal or already starting to decrease a little, you say, oh, you have either subclinical or already developed hypothyroidism. But what are you looking at? You are looking at the body's desperate effort to get its own thyroid gland working. You are watching how a small electric motor is trying to kickstart this big one here, the main gasoline engine. Could you please explain this to me? I am really struggling to understand where you got the logic. That suggests you need to add a hormone right here in this situation. Here you need to help the body to find out what it's lacking. First and foremost, iodine. Iodine is what? From the functioning of the thyroid gland depends on the presence of iodine in the body. You need to inspect this person's diet. Maybe you're dealing with a chronic vegetarian. And of course, what are you looking at? You are looking at the phase when the body has started to fall apart, but it is still resisting. You look at the side effects of the medications he is most likely taking. Nowadays, everyone is popping antidepressants, every other person really. And antidepressants, they disrupt the thyroid gland by altering sex hormones. Guys, you need to understand what you are looking at. Understand what you are looking at. And with this woman, doctor, you missed it. This woman on the dosage. This woman is on an external hormone dose, and even though she is correcting her nutrient deficiencies, she is showing signs of hyperthyroidism, which means the external hormone is already excessive. Well, explain to me, where did you get the idea that she needs even more hormone? Why do you want her to have it? She had suppressed thyroid stimulating hormone. Yes, and it will be suppressed anyway. When the thyroid function is restored, it will be suppressed anyway. This little electric motor will shut off, you see. But if you keep loading the person with external hormone here, the body recognizes that its own thyroid gland has gone out of control and it will develop autoimmune thyroiditis. That's all. That's it. And the next story is the one I told you about. A 67-year-old woman already came in with autoimmune thyroiditis. And if on December 14th, 2019, her thyroglobulin antibody level was 618, then after giving her a treatment plan and correcting her nutrient deficiencies, by August, after 8 months, it was 169, while the normal value is 115. In 8 months, her thyroglobulin antibodies dropped 5-fold. The body resolves the problem. You are looking at a living organism. You need to understand the dynamics. You need to understand what preceded this situation, and you need to predict where it will go. And you need to understand what the body needs. So, dear doctor, to be honest, thank you for this comment. And if, as you think, all endocrinologists, or most of them think this way now, it is a great tragedy. You see, medicine, it's a philosophy. We need to reason, we need to observe. And if you don't have an answer, then observe the person, ask them questions, look at their test results, look at their dynamics. After all, do you understand what the problem is? The tragedy of modern education? Why is the unified state exam so frightening? Because it's a machine. For cramming, retrotrophic, this is hypothyroidism, we prescribe hormones. It turns out to be autoimmune thyroiditis. We remove the thyroid gland. TSH is elevated. We have hypothyroidism. We prescribe hormones. Hormones are prescribed, antibodies increase. We remove the thyroid gland. Well, guys, this is a disaster. This is a disaster for your patients. In conclusion, I want to say that I don't know where you get these ideas, these conclusions from. Maybe it's from the so-called guidelines or instructions nowadays. It might say that if a person has elevated thyroid stimulating hormone, then they need to be prescribed additional hormone. Maybe that's what it says there. I've already made a video about what evidence-based medicine is and how, with the help of changes in medicine paid for by pharmaceutical companies, our healthcare system is being destroyed. Don't be naive. Boys and girls sitting there with rose-colored glasses, who don't need to think and who simply follow what's written in the guidelines, believing that they're treating the person. Because if we track the dynamics of what's happening, there's only one thing going on. A patient comes to you with elevated thyroid stimulating hormone, meaning the body is pushing the situation. It senses that something is wrong and it needs to activate its functions. And instead of thinking it through and figuring it out, you, according to the guidelines, give them Euthyrox. You give them Euthyrox. If their thyroid gland isn't completely destroyed, they end up with hyperthyroidism. Maybe they went to the seaside or traveled somewhere, right? With hyperthyroidism, their levels rise. For example, the thyroid stimulating hormone might linger, right? You somehow caught this situation. They end up with autoimmune thyroiditis and you send them for thyroid removal. You are creating people who have to take external hormones for life. And who told you that this isn't actually the goal of your guidelines? And who told you that these guidelines you're given weren't written for exactly this purpose, so that you just sit there saying, well, it says here and it says here? You don't even think about what's really happening. And you're simply creating an army of consumers of pharmaceutical products. So, my dear doctor, I strongly urge you to understand the intricate process. I earnestly urge you to understand exactly how the process unfolds. I urge you to remember that medicine is a profound philosophy, and that means a deep-seated love of wisdom, a love of quiet reflection, and the art of building complex logical chains. What from where? It's taken, you understand? And certainly, when a particular person comes to visit you, you can clearly see that he is currently on your specific dose of hormones, right? Hyperthyroidism is showing signs, although he had hypothyroidism before. And you see an increase in TSH, you look at the restoration of the body, especially when a person tells you that they have started taking a vitamin and mineral regimen. This means that the person has started to eliminate barriers, deficiencies of substances. The body, after all, it doesn't work. Listen, even for an engine to run on gasoline, it needs gasoline. But the body also needs nutrients in order to function. And there may not be enough nutrients. And the body starts to malfunction. This is a special mechanism. It's a living organism. That's why we study to become doctors, so we can see changes in biology, so we can observe changes in a living organism. Indicators are like instruments. And what does that mean? Well, you definitely don't understand this. The Enterox hormone is elevated, they removed it. The hormone is elevated, they increased it, they removed it. Come on, guys. If we flew airplanes like this, if our drivers, our pilots, with all these huge numbers of sensors, if they read the indicators this way, we would crash. Every single plane would crash. Listen, but you're basically shooting down your own patients. You're removing them, aren't you? Thyroid glands are being taken out left and right. Please, my friends, think about it. Think about what you're doing. Reason it out and assess the situation. Do you understand? Because when someone comes to us with hypothyroidism and we give them a treatment plan, we expect hypothyroidism if they are, of course, taking external hormones. Expected. We just sit and wait. To be honest, I don't care about their TSH level because it will be elevated anyway. because the body, it will have enough strength. It will realize what it is capable of, and it will start pushing the situation. It will start accelerating things. All right. When its function is restored, everything will naturally return to normal after some time. Do you understand? Because it's a living organism. It still needs some time to bring everything back to normal. It's not mechanics after all. You can't just snap your fingers and stop it. Even a car can't do that. It can't stop in a single second. It has a braking distance. Listen, the body also has a braking distance. That's obvious, isn't it? So, doctor, thank you very much for this question. And I ask you very much, think when you're at your workplace and don't allow your hands with these ridiculous guidelines to be used to deliberately destroy people's thyroid glands, send them for surgery so that they're forced to take hormones for life, while those who sell them get guaranteed profits. Don't be like them because they're doing it with your hands, with your mind. It's your mind, you understand? Don't do it, and you will become renowned as a smart and very effective doctor. This was Sofya Dorinskaya with you. All the best. Goodbye.